Hi, friends. Thanks for joining us tonight. Michelle Lentz here with the Child Protection League. And I wanted to uh, introduce you to Jennifer and Lou Pelletier. We are so excited to meet with them tonight and have them tell their story of what happened to Jennifer's sister and Lou's daughter, Justina. You've probably heard about it. It's been in the news for years. And this family's been through a ton. And the Child Protection League wants to get their story out and work with them as best we can to help children who are in similar situations. And so we're just going to get started here. Welcome, Lou and Jennifer. Thanks for joining us tonight and recording this short video. I'm really excited to see you again since it's been a few years since I've seen you.
Thank you, Michelle.
Thank you, Michelle.
So why don't we start by just recapping what happened to Justina and where you're at today.
You have to go all the way back to 2013.
So Reader's Digest version is Justina. Unfortunately, like a lot of people, she has a complicated medical history. She has her basic underlying issues. She has a metabolic disorder called mitochondrial disease, which for her impacts her the most in her GI system, and she has other areas. So it took a number of years to finally find the right team, the right doctors to deal with her, which was in Boston at Tufts Medical Center, a very world-class organization. And for about 2 years, things were working tremendous. Everything was moving along. She was being treated, but going to school, going ice skating, doing all the things that any other little girl would want to do. And then in February of 2013, a little over 7 years ago, she got flu-like symptoms. And her main doctor was a director of metabolics at Tufts, wanted her to see her GI doctor.
GI motility specialist.
Who had a specialty in motility, which very few in, unfortunately, the country have that specialty. But he and most of his team the month earlier went across town from Tufts over to Boston Children's Hospital. So the main doctor from Tufts really felt she needed to be rehydrated, and with her main issue being her stomach, really wanted her to see that doctor that knew her the best. So he basically said, you go from Connecticut, where we live, to Boston Children's. Mm-hmm. And there she was supposed to get admitted directly to the GI department, get rehydrated, get reconditioned for a few days, then come back home. But when she got to the emergency room at about 4 a.m, she was met basically by a neurologist, or a newer neurologist, who felt her issues weren't GI related, they were more neurological. So he ends up placing her in the neurology floor. And they said they're going to try some different things. And at first we said, fine, we're open to, if you can help Justina, we're all for it. But after a couple of days, we saw that they really weren't speaking to the doctor that sent her there. And more importantly, the doctor she came to see had no involvement in her care, hadn't seen her, wasn't. So,
and then Mom was given a paper on Wednesday evening that they wanted her to sign that said that they're not going to do any more diagnostic testing. My parents couldn't talk to specialists. She couldn't go back to her prior physicians, that they were going to take her off of all her medications. And the biggest thing is that she was not allowed to have a second opinion.
So we kind of demanded that
but you guys didn't sign it.
If you're not going to bring in the two most important people that know her, we're going to say thanks, but no thanks. And then that was on a Wednesday. The next day was Thursday, Valentine's Day, February 14th, where she actually had an appointment that day at Tufts. So I came up there from Connecticut to Boston to discharge her, to take her to Tufts. And then the world kind of fell apart. They wouldn't let her out. They said they called in DCF, doing what's called a 51A. That's Massachusetts' way of taking a child from a parent, saying she was being medically abused. And then the war started. It was a Thursday late afternoon. By the time that all ended, we had to go to the DCF office.
But they kicked you guys out of the hospital without letting you say bye to Justina. Justina had no idea what happened or where you guys went.
Then we had to go to court the next morning at 9 a.m. in Massachusetts, find an attorney in Massachusetts, and begin the process of trying to get our daughter given back to us. So they have what's called a 72-hour hearing, they call it, but it took 6 weeks to do this 72-hour hearing. And we had our doctors testify, and it looked like it was a slam dunk. Okay, they made a mistake, give us our daughter back, and the judge ruled in the favor of DCF and Boston
And
Children's
while
Hospital.
that time they were saying that Justina, you guys were doing Munchausen, but on the contrary, instead of her getting better with you guys being away, she was actually declining.
So
She went into the hospital, walking, skating, doing all sorts of activities.
So it was a long, long battle for 2 months. The first 2 months, she was on the neurology floor. Then after 2 months, they moved her to an inpatient psychiatric floor in the hospital. It's called the lockdown unit.
Also known as Beta 5.
We were allowed basically one hour visit with her a week.
Supervised.
That was limited, what we could talk about.
And
we were limited to 2 people a day, 2 people at that visit. We were allowed just one 20-minute phone call a week.
supervised. Anytime we're on property, we had to be escorted by the Boston Children's Hospital guards.
There was somebody from the DCF from Mass there. It was just, and we went back to court late in the November, December, again, trying to get custody back. And again, despite overwhelming evidence, the judge ruled in their favor. And even at the point they placed a gag order on us that we couldn't even talk about it to the, because by that point the press was involved, both the Boston Globe and Massachusetts, the local Fox stations here in Connecticut were starting to really pick up on this story. So for a few months, we bit our tongue, didn't say anything, but we saw what was happening in the courts. By early January, they actually moved her out of Boston Children's to an outpatient psychiatric facility. And again, they couldn't see her.
Behavioral facility.
And then probably early February, I decided to break the gag order. And I was on Fox News, Glenn Beck. We went on Dr. Phil. We did whatever we could to get the word out. And then it just started becoming a cause because we weren't winning in the court of law, but we were beginning to win in the court of public opinion, which was putting tremendous pressure on the state of Massachusetts. And then Massachusetts, DCF moved Justina to another facility, actually in our state, in Connecticut, but under Massachusetts DCF control, which was unbelievable. But we kind of saw things were turning around. They were being much more friendly or whatever. And then within 2 months of that transfer, one day we get a call that the judge is giving Justina back to us, no strings attached. So for 16 months, the state of Massachusetts, the Commonwealth of Massachusetts, had my daughter.
And they had there was no reason, nothing, no standard you had to meet, nothing you had to prove that you hadn't proved before that, you know.
All of a sudden they just said that my parents just got a call that you can take her home.
Yeah, we were pushing the whole time for a reunification plan, which they didn't want to do, but they knew she wasn't getting better with them. They weren't doing anything. And they were just mad that we were making this a public story. We were making, you know, because if we didn't do that, she would have been placed in foster care.
They gave both of you, at times in the meetings, you and Mom, the papers for foster care and adoption papers.
They wanted to give our daughter. And that's, if we didn't fight and fight and fight, she would have been with another family, which would have been another whole war. It was just, as we keep saying, it was David against Goliath. You're fighting the hospital, which is Boston Children's, which is owned by Harvard, the wealthiest institution in the country. And we are fighting the state of Massachusetts, and both have pockets that are a lot deeper than ours.
Right.
And so we did finally get her back in June of 2014.
Severely deconditioned. She couldn't sit in a chair without support, and she was not the same kid. What they've done to her is disgusting.
So for the next year, it was just trying to get medically the things that were really ignored treated. And she had a number of procedures done and so forth. And Then we started really pushing the physical therapy. And in the fall of 2015, she started doing therapeutic horseback riding. We're jump ahead 5 years. She's competing in it on her own, regular rider. And outside of getting on the horse or getting off the horse, she's no different than anybody else. So
But you're leaving out that she had to have other procedures
Yeah.
after leaving the hospital, like from them neglecting her port that she had to help her GI system move to go to the bathroom. That whole system failed from them neglecting it. We actually found out from the lawsuit that just happened, they had it notated in her medical records that she didn't go to the bathroom for over a month.
or just a few times in that month, which is unbelievable.
That's unbelievable.
Their goal was to take that out, and they sabotaged it. So to the point when she got out of the hospital, her colon was already starting to shut down. So she had to have a bag put in, giving that hope to maybe let her colon regenerate and restart again. But it was already too much damage. So she had to have her whole colon removed. Now she has the colostomy bag.
So
this was a clear case of medical kidnapping.
Absolutely.
All of the public publicity. I mean, I know Michelle Malkin did a story on Justina, and that all the other media that interviewed you. It's just it's pretty obvious at this point what that was that you endured, that this was a medical kidnapping, this was an abuse of child protection services. And I just want people to understand, if I'm understanding this correctly, that Boston Children's maintained the position that Justina had somatoform disorder, right? Do you want to speak to that a little bit? I mean, no wonder she was deteriorating in their care.
So they're trying to say that everything was in her head.
or a large
Which is what that is, somatoform disorder.
So think of psychosomatic, which is you're making everything up. So somatoform could just be a percentage of your ailment is in your head, or the amount of pain you have is in your head, which is so. How do you quantify that? How does you put two people together, and they both have a stomach ache? One could be rolling over, and the other one could be just sitting there eating potato chips because it's not bothering. Everybody's different, But Boston Children's Hospital, as we've of course learned through this whole process, somatoform, the psychosomatic illness, is one of their bread and butter items to do research on. The head of psychiatry at that hospital is the co-author of the medical textbook on pediatric somatoform. So the woman that was a psychologist that did the initial diagnosing of her has written many articles on psychosomatic illness, including one that says 1 out of 2 pediatric patients has it, because hospitals have to figure out a way to cut their costs. And if whether it's reporting somebody to DCF, and by the way, one of the things, I'll jump ahead a little bit, but when we had our trial, we found out that their child protection doctors, Boston Children's, has 5 cases a day to investigate, and 2 of those 5 a day get reported to DCF, meaning DCF is taking, on average, roughly 2 kids a day. And as we learned, if a child is now under DCF, they're a ward of the state that they're in this case, Massachusetts. And most children's hospitals' bylaws copied a law that was written in 1993 under Bill Clinton
in Health and Human
Services that said if you're a ward of the state in a hospital, they can do any pretty much medical or psychological research with no consequences. So what happens? You're under DCF control. Who's paying the way for that research? That state's Medicaid system. So it's a big booming business at Boston Children's, and I got to believe it's a big booming business at almost any pediatric hospital that follows those same bylaws.
Because they have it in fine print in their guidelines.